Hello, everyone. My name is Mark Jacobs, and I'm with MJ Benefits Advisors. Thank you for watching my little presentation. Hopefully, if you got about 30 minutes here, hopefully I get through this in about 30 minutes and can remove some of the confusion when people are talking about Medicare. Again, a little introduction about myself. My name is Mark Jacobs. I am with MJ Benefits Advisors, and I am a trusted guide in the complicated and confusing world of healthcare benefits. I do consider myself a master warrior advisor, professor of all things insurance, and protector of all mankind. Okay, I have been in the health insurance field since 2018 as an independent broker. I can help anyone from birth to death. I can help families. I can help group. I can do everything. But I kind of tend to specialize more on the Medicare side. So in that space, I tell everybody my greatest ability lies in to be able to analyze and navigate the critical crossroads between Medicare Advantage and Medicare Supplement plans. I do not favor one over the other. Both of them have the place in our industry. I do not believe in one size fits all shields. Instead, I carefully analyze your unique situation, what your healthcare needs are, what your prescriptions are, and what kind of budget you have to determine whether the all-in-one convenience of a Medicare Advantage plan is best for you, or the network-free freedom and predictable cost of a supplement plan is your best defense. I do take pride in breaking down the complex rules of copays, deductibles, networks, and everything else so you can step into your golden years with an absolute confidence and total peace of mind. So let's get this ball rolling. So, understanding Medicare in 2026. I am recording this in 2026. So, all the figures that you see currently in 2026 will be accurate. But if you're watching this in the years beyond, all the information will still be correct. It's just the dollar amounts that I show on here will probably be raised just a little bit, maybe 10, 20 bucks on each one. So let's get into it. Let's get into meat and potatoes. Okay, so what is Medicare? Am I eligible, and how do I enroll? Well, Medicare is a federal program that offers health insurance to American citizens and other individuals based on your age, your disability, or a qualifying medical condition. Okay, it is not a group plan. It does not cover spouses or dependents. It is totally an individual insurance. To be eligible for Medicare, you must be a U.S. citizen or legal resident. Legal residents must live in the U.S. for at least 5 years in a row, including the 5 years just before applying for Medicare. You also must meet one of the following requirements. You have to be age 65 or older. You can be younger than 65, but you have to have a qualifying disability, which means you have to be on disability for a minimum of 2 years before you qualify. Or at any age if you have a diagnosis of end-stage renal disease or ALS. So here's the part everybody keeps asking me. When is it time to enroll? Well, when you're first turning 65, you have a 7-month enrollment period. It starts the month of your 65th birthday. It goes back 3 months before, and then it's 3 months after. So you have a 7-month enrollment period. Okay, now if you're already collecting Social Security, you will automatically be enrolled in Part A and Part B. You'll end up receiving your Medicare card in the mail about 3 to 4 months before your 65th birthday. All right, but if you don't, you do need to enroll into Medicare yourself if you're not receiving any of them. All right. Easiest way to do it is go to ssa.gov, which is the Social Security Administration online, or you can visit your local Social Security office. Okay, here's some questions that I also get asked a lot. I get asked, all right, Mark, hey, I am turning 65, but I am going to continue to work for a couple more years, and I have really good group insurance from my employer. They pay for it all. Do I really have to enroll into Medicare? Well, the answer is no. But here's a couple of suggestions. Okay, you still need to go through your initial enrollment period because with Part A, which I will explain a little bit later in this presentation, Part A doesn't cost you anything. So you should at least sign up for Part A. All right, it'll save you a little bit. But the big kicker, whether or not you can or cannot enroll into Medicare, is the number of employees that your employer has. If you work for a company that offers qualifying health coverage, which most group plans are qualifying, right? They also have to have a minimum of 20 employees. Okay. If they don't have to minimum 20 employees, it's not credible. Okay. All right. So, but you need to pay attention to some of the details. Here's another thing that a lot of people don't realize. If you are looking to go into Medicare at age 65, pay attention to the details. If you're getting ready, if you're going to go on Medicare at age 65 and you have an HSA, a health savings account, you have to stop contributing to that account 6 months before you start Medicare. What does that mean? Hey, if you're going on Medicare in June, you need to stop contributing to your HSA in January. All right? So let's go on to the next string, see what it has to say. Okay, this is what we talked about earlier. This is your 7th month initial enrollment period. And timing is everything, because if you enroll properly in this time frame, you don't ever have to worry about late enrollment penalties. Okay, so again, your initial enrollment period starts 3 months before your 65th birthday, the month you turn 65, and 3 months after your 65th birthday. Pro tip, I absolutely suggest that you start rolling 3 months before, because in today's world, it could take them a month to 6 weeks for them to get you your Medicare card. Okay, and your coverages can begin on the first day of your birthday month. Doesn't start on the day of your birthday, but the first day of your birthday month. And if your birthday's on the first day of the month, you're actually eligible to enroll the previous month. So if you were born February 1st, you can actually start your enrollment and start on Medicare on January 1st. So again, pay attention to the details. Okay. So where do I go to enroll into Medicare? You have a couple of options. Here are the most convenient ways. So number one, of course, is like I said before, go to ssa.gov, the Social Security Administration's portal. There will be a box up in the corner that says enroll into Medicare. And you can fill, it's a simple form. They're going to ask you to fill out what's called an ID Me Now account. Make sure that you save the email address, the sign-in name that you use, the email address, and your password. Write it down somewhere, because you can get back into that account and it'll tell you where you're at in the process as you go on. And if you lose that information, it's a pain to get it back. And of course, the other way is that you can call into the Social Security hotline, which you have the number right there, 1-800-772-1213. They won't enroll you over the phone, but what they will do is they will set you up with an appointment that you can go down to your local Social Security office to have them enroll you personally. All right. There's a little box right there that you can click on. It's a Social Security office locator. You can also find this information on ssa.gov and on 1-800-Medicare. Okay, so what are the 4 parts to Medicare? Now, this is where we're going to get kind of confused, or at least I tend to try to keep people from getting confused. There's a lot of information when it comes to all the different parts to it, but we're just going to go over the basic stuff, okay? So, what is Part A? What is considered original Medicare? Well, the first 2 parts is Part A, which is hospital insurance, Part B, which is medical insurance. It is considered original Medicare because that was the only 2 parts to it when the system was established in 1965. Okay, Part C, which is Medicare Advantage. Medicare Advantage was originally called Medicare Plus Choice. It was created by the Balanced Budget Act of 1997. Okay, it was designed to expand private healthcare options for beneficiaries, encourage managed care efficiencies to reduce government costs, and to relieve the systems of financial strain ahead of the aging baby boomer generation. All right. So, and the last part is Part D. Okay, Part D, it originally came out in January 1st of 2006. It was authorized by the Medicare Prescription Drug Improvement and Modernization Act. Before that time, you had to get a Plan J from a supplement to be able to cover prescriptions. But in 2003, all that changed. All right, so let's go in and let's dive a little bit deeper. Now, as we're going over all this, that I hope to be able to set an appointment with you all after you watch my presentation. So grab a pen and a paper before we get into this. And if you have any questions, or if I don't cover things on this presentation, if you come up with answers, write them down when we get together and meet in person, either in person or over the phone. Write them down and I'll answer your questions at that point, okay? All right, here we go, guys. Hold on to your seats. Okay, so Part A. What is Part A hospital insurance? What does Part A cover? It covers that semi-private room that you're going to be in, that wonderful hospital food. It does cover some skilled nursing services, care and special units such as intensive care and skilled nursing, of course. It does have some coverage for drugs, medical supplies, medical equipment that's being used during an inpatient stay. It has coverage for lab tests, x-rays, medical equipment as an inpatient in the hospital. All this is as a patient in the hospital. Covers the operating room and the recovery room. Covers blood transfusions, inpatient and outpatient rehabilitation services after a qualified inpatient stay. Part-time skilled care for the homebound after a qualified inpatient stay. Hospice care for the terminally ill, including medications to manage symptoms and control pain. Okay, so what is the cost for Part A? As we talked about earlier, most people are not, it's going to cost most people nothing, because what you have to do is you have to work 10 years, 40 quarters, or 10 years and pay Medicare tax, either you or your spouse. If for some reason you don't have enough quarters to be able to qualify for the zero premium, and your wife or your husband does, you can claim off of them. But if neither one of you have enough quarters to cover for Part A, it will cost you $565 per month. Now, there's some deductibles and copays that come with Part A. The big one is the hospital deductible. It is $1,736. Now, it says per benefit period. Now, I'm going to explain what the benefit period is. Okay, when you first go into the hospital, you pay that $1,736. And it is good for 60 rolling days. When I mean 60 rolling days, you can be in the hospital for 3 days, come out, come back in 2 months or a month later, 30 days later, you won't have to pay that $1,736. Okay, you have to be discharged from the hospital for 60 consecutive days. All right, so we all understand that? Good. If you got any questions about that, make sure you write it down. I'll answer it when we talk in person. Okay, the other part of hospital insurance. These are Part A costs for 2026. And that's another thing, guys, is this is just with the original Medicare. All right, this is talking about costs for skilled nursing. Or what you'll pay. No, I take that back. Sorry. This is what you'll pay for if you're in the hospital. For, like I said, for the first 60 days after you have that Medicare deductible, so you pay nothing for the first 60 days. But if you happen to be in there days longer than 60 days, for days 61 through 90, you're going to pay $434 per day. Okay, if things are really bad and you're in there past 91 days, it's $868 per day. Now, Medicare only covers up to 90 days, but you do have 60 lifetime reserve days that they will pay for also, and that's where you pay this $868. After you've been in the hospital, if you've been in the hospital longer than 120 days with original Medicare, then you're paying all that cost out of pocket. Okay. The next one is skilled nursing facilities. For the first 20 days, from days 1 through 20, when you go into a skilled nursing facility, doesn't cost you anything. It's a $0 copay. Okay, but at day 21 through day 100, and original Medicare only covers the first 100 days in a skilled nursing facility. Okay, you'll pay $217 per day, all right, for days 21 through 100. Hospice care, that is usually doesn't cost anybody anything because that is kind of considered end of life. There are some other stipulations, but if that's something that you guys got questions about, I'll answer more of those questions in person and spend the time to do it here. All right, so there's one other stipulation of Part A and Part B that we'll get to a little bit later, so hold on. There's more cost than just that, but it's a combination of Part A and Part B. Okay, so what is Part B? What does it cover? All right, Part B, Medicare Part B is medical insurance. It covers your doctor visits, including if the doctor can visit you in the hospital. Covers your annual wellness visit. Covers your ambulatory surgical center. It covers ambulance and emergency room services, skilled nursing, some skilled nursing, some preventative services such as flu shots or mammograms, clinical laboratory services such as blood or urine tests, x-rays, MRIs, CT scans, EKGs, and other diagnostic tests, some health programs such as a stop smoking cessation program, obesity counseling, and cardiac rehab. It has physical therapy as well, occupational and speech both, as well as pathology. Has diabetes screening, diabetes education, and certain diabetic supplies. It does cover mental health care, durable medical equipment for use at home, such as wheelchairs, walkers, etc., and telehealth visits. Now, with the durable medical equipment, it covers durable medical equipment, but you're responsible for 20% of the cost of your durable medical equipment. Okay, so how much does Part B cost? That's the next question everybody asks me. Okay, so Medicare Part B does have a monthly premium that comes with it. Currently, if you're below, as a married couple, if you're below $219,000, $109,000 for a single individual, your premium is going to be $202.90. That is for 2026. If you're watching this beyond 2026, it usually raises about $10 to $20 a year, depending on what the economy is like. Okay, so the amount you pay can vary depending on your tax reported income. It's your adjusted gross income. And you have to remember, it has a 2-year look back. Okay, so $202.90 is considered the standard amount. It doesn't matter if you only make $50,000 or if you make $108,000. You're still going to pay that $202.90. Now, you'll qualify for the standard amount if for a few reasons, and you have to meet each one of these. If you enroll for the first time in 2026, if you aren't receiving Social Security benefits, if your premiums are billed directly to you, you have Medicare and Medicaid pays your premiums. But here's the big kicker. Okay, your 2024 reported income was less than or equal to $109,000 for individuals and $218,000 for couples. Each year as it goes on, so each year past 2026, they usually raise it about $6,000 to $8,000 a year. All right, you will pay an income-related monthly adjustment amount, IRMA is what it's called, if your reported income from 2024, remember it has a 2-year look back, all right, was above $109,000 for individuals or $218,000 for couples. So if you're going on Medicare in 2026, they're going to look at your income that you had in 2024. All right. Part B also has an annual deductible that you have to meet. And this is just for original Medicare, so don't freak out yet, guys. Okay, this is an annual deductible of $283. That usually changes about maybe $5 to $6 every year too. So that if you're watching this beyond 2026, that will go up a little as well. All right, so here's the big kicker. You all ready? Here's the drum roll. Boom. Original Medicare, Parts A and Part B, only covers 80% of your medical expenses. You are responsible for the other 20%. As it says right there, you generally pay 20% of your Medicare approved amount for the cover services you use. Here's the other big kicker. There is no annual out-of-pocket maximum. It doesn't matter. There's no limit. If you go into the hospital or whatever and you come out with a $100,000 bill, you're responsible for 20% of the cost of that bill. Okay, so at this point, people are starting to get a little worried and starting a little flashy in the eye. And they ask me, okay, Mark, so what, that's ridiculous. How can anybody afford to pay that? Here's your options to cover the other 20% and the copays and deductibles that come with the original Medicare. Okay, choosing your path. Again, there is no one-size-fits-all Medicare plan. You have 2 primary ways to cover those options. Okay, sitting down and having a conversation with your spouse or understanding what your needs are and having a conversation with your independent broker. This is where it's super important. Okay, so the first option is Part C, which is Medicare Advantage. All right, Medicare Advantage is, like I said, it's a plans that combine Part A and Part B benefits. Medicare Advantage plans are offered by private insurance companies that are approved by Medicare. Now, everybody keeps saying, well, you go off original Medicare, which you do, and you go to a private company. But the thing is by law, a Medicare Advantage plan has to cover everything that original Medicare covers. The main differences with the Medicare Advantage plan is most of them are $0 copays. They don't cost you an extra monthly premium. But it is managed care. It's the same sort of product, the same sort of system that you're on when you're on a under 65 product. You are on a network of doctors, and the insurance company has a say-so in your medical decisions. Okay, that's the biggest drawback to Medicare Advantage. All right. But yet, if your income is low and you can't afford the cost of a supplement, this is a very good option. You're going to be fine on both. You're just going to have to jump through a couple more hoops, like you currently are right now on an under 65 product. But it also has some additions that they offer with a Medicare Advantage plan. Most of them do have Part D prescription drug coverage, which we'll talk about in the next couple of slides. And the other one, they give you a little bit of coverage for routine hearing exams and hearing aids, routine dental care, routine eye care, eyeglasses or contact lenses, and they usually give you a wellness benefit such as a gym membership. Some plans will also give you a little bit of money each month for over-the-counter products, for like aspirins and different things like that. If you're on Medicaid, they also have plans that will help you pay for, on a gas bill or electric bill. But that all depends on what your individual case is. Okay, so Part C, a Medicare Advantage plan. All right, the difference between a Medicare Advantage plan and what you were currently on before you came on Medicare is on a group plan. You usually have a deductible. It can anywhere be from $1,000 up to $10,000. That's the amount you have to pay out of pocket before the insurance company starts paying anything. Okay, with the Medicare Advantage plan, it is 100% a copay plan. Everything you do, there's a copay for. There's a few exceptions, like on almost all Medicare Advantage plans. Going to see a primary care doctor usually doesn't cost you anything. But if you go see a specialist, depending on the plan you choose, it can be anywhere from a $15 to a $45 copay. Instead of paying that $1,762, if you go into the hospital, there's a copay per day. You can go anywhere from $175 per day up to $400. But most plans limit the number of days. Most of them are around 5 to 7 days. So if you're in the hospital more than a week, all right, you stop paying. If you're underworked, of course, you pay whatever the daily benefit amount is. But what they do is this gives you coverage starting on day one. The insurance company starts to pay on day one. Okay. The max out of pocket can range in the amount that the insurance companies can set per year is set by CMS, which is the Center for Medicaid and Medicare Services. For 2026, the limit is $9,250. Now, I will tell you, not every plan is going to be at $9,250. It depends on what type of plan it is, if it's an HMO, if it's a PPO, and the insurance company has the discretion of setting their max out of pocket at whatever figure they feel comfortable with on that plan. Okay, most of them are usually not around $9,250. But what that is they take all those copays and everything else that you paid during the year, total them up as the year goes on. Once you reach whatever the max out of pocket is for the remainder of the year, all your medical costs are free. They don't cost you anything once you reach whatever your max out of pocket. Now here in Florida, on an HMO, which is a smaller network, the max out of pocket is usually somewhere around $3,300. Okay, on a PPO, which is a bigger network, has you coverage for outside of your service area, that's usually somewhere around here in Florida around $6,700. Now, if you're in some other state besides Florida where I'm at, you could see plans that could be up to $9,250. Okay? Okay, so let's move on from there. All right, the following costs do not count towards your max out of pocket. That's the premium. If you're on a plan that has a premium, most of them don't, but there is some that have like a $5, $10, or $20 or $30 premium on it. Most of my clients are on the zero premium plans. Drug cost, okay, for whatever you're paying for your prescription drugs, the ones that you get from the pharmacy that you take at home, All right, that is not included in the max out of pocket. All right, except for Part B medication. So, what is Part B medication? Any medication that is administered to you in a doctor's setting or a hospital is paid for under Part B drugs. Okay, and I should say under in a doctor's office. All right, you're responsible for 20% of that cost, but that cost of that medication does count towards your max out of pocket. Okay, the extra benefits that they offer in a plan, such as vision or dental, that does not apply towards the max out of pocket either. Okay, so we're going to talk a little bit more about prescription drugs because there's a part to it for a Medicare Advantage plan that is different than what it is for a supplement. Okay, so for prescription drugs, here's the breakdown on Part D. Now, most Medicare Advantage plans, there is some that are just considered that are more for veterans that doesn't have any prescription drug coverage on it. The reason that is because with most veterans, they already have coverage through the VA, and the cost of the medication is cheaper and less expensive through the VA. But most every other plan that's out there has a prescription drug plan included into it. Okay, so like it says, Medicare Part D plans provide coverage for prescription drugs and vaccines. Drugs are most commonly purchased for Medicare beneficiaries the coverage includes drugs most commonly prescribed for Medicare beneficiaries is determined by the federal standards. Specific brand name drugs and generic drugs are included in the plan's formulary. Most commercially available vaccines not covered by Medicare Part B, there's coverage included in that for it. Drugs not covered, there's some drugs that are not going to be listed on the plan's formulary. What happens is CMS, the Center for Medicare Services, tells the provider that, hey, you have to cover in a minimum of 2 different types of drugs. There's 6 different categories, and if I go into all that, I'm going to confuse you. But you have to cover at least two types of medications in each one of these categories. But it is up to the provider, to the insurance company, which 2 they want to choose. Okay, some of the things that are not covered, that is not covered on a standalone, on a prescription drug plan with Medicare Advantage or a standalone plan, is of course the drugs that are not listed on the plan's formulary. But if you're halfway through the year, I should bring this up. If you're halfway through the year and you are getting you prescribed a medication that's not on your formulary, you can ask for what is called a formulary exception. Okay, you have to go through your doctor to get that done, and most plans will grant the exception if it's for like a 3, 4, or 6 month period. But if you want to continue on that same plan and try to get the same exception for the next year, you have to file it every year. Okay, but some of the other drugs that are not listed or that are not covered by prescription drug plans, these are plans that are prescribed for anorexia, weight loss, or weight gain. Now we're talking about GLP-1s and everything else. The rule right now in Medicare is that they won't cover a GLP-1 unless you are a full-blown diabetic. Okay, you have to be a diabetic for them to cover those medications. If you're using it for weight loss, you're going to get denied. Okay, there's currently it's supposed to start in July of 2026. If you need those medications, that because there is a benefit to keep you from being diabetic. Things are changing in that market, but ask me when we meet in person as far as what's going on currently, because there are some changes that are coming for at the end of 2026 and into 2027. Okay, prescription for cosmetic purposes or hair growth, those are not covered, and prescription drugs like vitamins and minerals, those are not covered either. And non-prescription drugs, i.e. over-the-counter medications. All right, so you can get Part D prescription drug coverage through a private insurance company in 1 of 2 ways. Either a standalone Part D plan, which you would get for a Medicare supplement, or a Medicare Advantage plan. They all use, like I said earlier, they usually include Part D coverage. Now, what you need to consider when you're choosing a Part D plan, number 1, of course, is cost, and it will vary by plan and provider. All right, each plan has its own formulary. That's the drug list. So if you're looking at a plan that is not covering one of your medications that you really want to have to stay on, that's something you need to consider. Some plans have network pharmacies, which means if you go outside of their network and go to a standard pharmacy, it's going to cost you more for the medications instead if you don't stay in the preferred pharmacies. Okay, and your cost can vary depending on the drug coverage stages, which we'll cover here in just a minute. You must live in the service area of your Part D plan or your Medicare Advantage plan that includes Part D coverage to enroll. What that means is if you're wherever you're living at and you decide that you're going to move and you're going to move 3 counties away or you're going to move to another state, that means they're going to drop that plan from you, and you have 63 days to enroll into another Medicare Advantage plan, a Medicare Advantage prescription drug plan, or a standalone prescription drug plan. But if that is happening with you guys currently, just let me know and we'll work that out. Okay, so here's a note to veterans. People who have benefits through the Department of Veterans Affairs may be able to get prescription drug coverage through the VA and might not need Medicare drug coverage. So talk with your VA benefits administrators for making any decisions. That's what I talked about earlier, that if you are a vet, that you will have prescription drug coverage through the VA, and the drugs are usually cheaper through there. All right. Okay, guys, so now we're going to talk about Part D prescription drug plans. There's 2 types, of course. One that comes with the Medicare Advantage plan. Those are called Medicare Advantage prescription drug plans. There's usually not an extra premium for a Medicare Advantage prescription drug plan. But the other one is a standalone Part D plan. There is a extra premium that you pay for those plans. There's some that are in this country that can start out as $0 or it doesn't cost you anything, and others will go as high as $180, $200. All right, so what I'm going to do here is I'm going to show you what you need to be concerned with when you are looking at a standalone prescription drug plan. What's the major parts that you need to be worried about? Okay, first is the premium. All right, there's plans that, like I said, that start at $0. Most of those plans usually are for Tier 1 and Tier 2 medications. All right, you do have coverage for Tiers 3, 4, and 5, but it's at a much higher rate than what most other plans are, significantly higher. Okay, other plans could have a deductible amount, which is the next box down. For standalone prescription drug plans are allowed to charge a deductible. That deductible amount is set by CMS, the Center for Medicare Services, and for 2026, the annual deductible limit is $615. Now, that does not mean that every plan will be at $615 for 2026. You'll see plans out there that have a deductible of $300. You'll see them at $500. You'll see them at $600 and $601. Okay, just a bunch of silly little different numbers. But that is another difference. If you're on the deductible usually doesn't kick in until you're on a medications that's Tier 3, 4, or 5. Okay, we'll talk a little bit later what Tier 3, 4, and 5 is, but it usually doesn't kick in unless you're taking one of those medications. And it can be significant in your cost, so you need to pay attention to that. Now, the other one is a copay. Now, with each medication you have, as you're going through, and we'll talk a little bit more about this a little later, is with the copayment, if you are paying, if you're on a Tier 1 drug, which is the preferred generic, usually doesn't cost you anything. A Tier 2 costs you maybe $5. Tiers 3 is usually a percentage anywhere from 19 to 30%. Same way with Tiers 4 and Tiers 5. Tiers 3 is a preferred brand name drug. Tier 4 is a non-preferred brand name drug, and Tier 5 is a specialty drug. There's also some plans that have co-insurance set on them. So that's another thing we need to be talking about, depending on if you're on some really expensive medications. Okay, so the things you need to do is you need to review the drug plan's formulary. Whatever medications you're on, you need to look them up and make sure they're covered. And they will tell you if they're covered or not. They will cover you. They will tell you if there's a deductible to it. They will tell you, what your annual cost for it is. Okay, plans do add and remove specific drugs from their formulary from year to year. Changes may be made during the year under certain circumstances, such as if a drug is removed from the market. Total prescription drug costs will also be affected by the number of prescriptions you take, how often you take them, how you get them, if you get them from an in-network or an out-of-network provider. All right, what part D coverage stage you are in, and you'll learn more about the different coverage stages on the next slide. So let's go ahead and go over to that next slide. These are the different stages that you go through. There's the annual deductible stage, the initial coverage stage, and the catastrophic stage. They're really pretty simple. If you are on a tier 3, 4, or 5 medication that has a deductible on it, you stay in the deductible stage until you meet that deductible. Once the deductible is met, you go to the initial coverage stage. This is where you have a copay or coinsurance, and you stay on this plan until you have $2,100 in out-of-pocket prescription drug cost. Okay, at that point, you automatically enter the catastrophic coverage stage. In catastrophic, after you paid $2,100 in out-of-pocket drug costs, you're going to catastrophic, which means you don't pay anything for your medications for the remainder of the year. Okay, it resets every January 1st. So if you hit $2,100, which there is people out there that do hit that, if you hit $2,100, say in September, October, for the remaining 3 months, you won't pay anything for your medications. Okay, but it resets again in January 1. Okay, so now let's talk about drug tiers. Okay, so each one of these, there's 5 different drug tiers. Your drugs can vary from the planned drug tiers. So there's tier 1 is, like I said earlier, tier 1 is a preferred generic medication. Tier 2 is a non-preferred generic medication. Tier 3 is preferred brand name. So that makes tier 4, what do you think, guys? Non-preferred brand name drugs. Tier 5 is specialty medications. Something that is formulated especially for you. Those are your really more expensive medications. All right. Now, some medications are subject to coverage rules or limits. Some medications may have coverage rules or limits on the amount you can get in order for the plan to cover them. This includes things like step therapy, quantity limits, and prior authorization. So what's step therapy? Step therapy just means that your plan may require you to try other prescriptions to treat the same medical condition. All right, if there's a medication that's supposed to be doing the same job that's a little less expensive than what you're currently taking, you have to agree to try that medication. Now, if you've already tried it in the past and it didn't work, which was something that would come from your doctor, we can move on. And they don't make you go back to it every year. They don't make you try it over and over and over again. All right, if you're on something that works and your doctor wants you to stay on that, step therapy is removed. Next one is quantity limits. Quantity limits means that the plan will only cover a certain amount, a certain number of pills or medications, or a certain amount of the drug over a period of time. Like most of that has to do with pain medications. They'll usually give you 7 pills for like 7 days or whatever the number is that you're allowed to take for that day. So that way you're not abusing that medication. Some other ones have what's called prior authorization. That means the plan needs more information from your healthcare provider before covering the drug, which means they're asking your healthcare provider what is her need for this medication, is why are you prescribing this to her, and the doctor has to answer that. Okay, so now for the second thing that you can cover that other 20% with from original Medicare and the copays and deductibles, we're going to talk about Medigap, which is also called supplements. Okay, now what is the difference between a supplement and a Medicare Advantage plan? Several, actually. A Medigap plan, it includes full or partial coverage for all of Part A, blood transfusions, and it also gives you an extra 365 days if you have to be in the hospital, so that's important. If hospice has any co-insurance or anything like that, covers your Part A deductible. There is no plans that you're able to get on anymore that covers that Part B deductible, which we talked about earlier, which is $283. There is not a plan that a Medigap plan that covers your Part B deductible. It does have coverage for foreign travel emergencies up to plan limits. Most of them are 80%. They'll pay 80% of your healthcare costs if you're traveling on an emergency basis. They won't let you go over and get a tummy tuck in wherever in Mexico, they won't pay 80% of that. But if you fall, break an ankle, or get admitted to the hospital or whatever outside of the country, they'll pay up to 80% of your medical expense, up to $50,000. Okay, it also pays for Part A skilled nursing facility care that we talked about earlier. But like I said, there's no plans that since 2020 that will cover the Part B deductible. You have to turn 65. You had to turn 65 before January 1st of 2020 to be eligible to get a Plan F or a Plan C. Those are the only two plans that cover the Part B deductible, and most people are stepping away from them because the premium's so high between that and a Plan G. But we'll talk about that a little bit later. All right. So Medigap plans, they set their own premium cost. Medigap plans set their own premiums through, though, as a general rule, the more generous the coverage, the higher the premium. What that means is they're basically saying the Cadillac plan right now is a Plan G. Okay, if you step down a little bit, next step down would be a Plan N and so forth. So you're going to step down a little bit in premium. And there is differences between the different plans. So if we come to the point where we have this conversation about Medigap, I will gladly explain what the different levels and different plans are. Okay, again, same thing, level of coverage of what you pay varies by plan. Some plans split certain costs with you to a set limit. Other plans leave certain costs for you to pay on your own, so on and so forth. There is Medigap plans that will give you some of the discounts on vision, hearing, and dental services. It's not really that they give you a discount on it, because actually when you get on those plans, if you really look at the difference between a standard Plan G and a Plan G Plus, there's usually about a $10 to $20 difference in premium. So you're paying for those services out of the way. They're just adding it on to your premium for your supplement. Okay, and they'll give you some free or discounted gym memberships. Okay, so now we're going to go on to the scale that shows you what there's 10 different supplement plans. Okay, and this is a comparison chart. Now, if you look on the right-hand side of that, this is some of the different things that original Medicare does not cover. If you move over to the left, it tells you what Plan A, Plan B, Plan C, Plan D, and so forth. They will tell you the percentage of what that plan covers of those issues. For example, Plan G is a Cadillac plan. If you notice, it covers everything at 100%, with the exception of your Part B deductible. Doesn't cover that at all. All right. And it only covers up to 80% of your forward travel for emergencies, up to plan limits. So like I said before, most plans is up to $50,000. Now, the other thing you need to know about a Medigap plan, okay, they are government regulated. So it doesn't matter who you're talking to. It doesn't matter if you're talking to, for example, United Healthcare, Humana, Aetna, WellCare, Physicians Mutual, whoever, Jim and Bob's Fish Shack. They are all government regulated, which means they have to cover the same things, same ways, and cover the same things, pay the same way. They have to be identical. The only difference that they can have is that some of the plans can add, like we said earlier, some coverage for dental or vision or whatever. That can be decided by each provider. The other thing that they're allowed to do that is different between each company is how much their premium is. Now, some of them will be age attained, which means they'll always rate you at whatever date or whatever age you was when you got on the plan. So if you got on the plan at age 65, they will always rate you at age 65. But the other stipulations on the other side of that is that whatever their cost for their members on that particular plan is, they can raise their premium per year according to that rate also. Okay, I guarantee you that these rates are going to increase. Some plans, some companies will be around 4 to 5%. Some can be as high as 10%. Some will be as high as 15 or higher. So it's important that you take a look back on the last 5 years of what their rate increases be, what percentage their rate increase was. Okay, because there's companies out there that will give you a really low cost when you first turn 65. Okay, but as the years go on, then you're starting to pay, instead of 4 to 5% increases, they're giving you 15 to 20. So you lose that extra. I mean, they make up that difference really quickly. Because there's one thing that you should know when it comes to Medigap and when it comes to Medicare Advantage. When you first turn 65, you have what's called guaranteed enrollment for the first 6 months after you turn 65. which means it doesn't matter what's wrong with you. You can have what pre-existing conditions you might have. You can have a cancer, a heart attack, stroke, end-stage renal disease. You can have Lou Gehrig's disease, everything under the sun. And a Medigap plan and a Medicare Advantage plan has to take you. Now, a Medicare Advantage plan always has guaranteed enrollment. A Medigap plan only has guaranteed enrollment for the first 6 months. Okay, what that means is if you go on a Medigap plan with a certain company and you wait 6 months and decide you want to change to somebody else because you just don't like them or whatever the reason might be, you would have to go through what is called underwriting, which means that you would have to go through underwriting questions. And that's where your pre-existing conditions would come into play. The other thing I should tell you is that with Medigap, or you also have what's called a 12-month trial right. Now, when it comes to Medicare Advantage, if you have never been on a Medicare Advantage plan, okay, you can switch from a Medicare Advantage plan or from a supplement to a Medicare Advantage plan, and you have 12 months of a guaranteed trial right that you can try for 12 months. If you don't like it, you can go back to the Medicare or the Medigap plan that you were on. Don't have to go through underwriting, don't have to go through anything. The only difference is if there has been a rate increase while you were gone, you would have to go back at the new rate increase. Okay, that's if you've never been on a Medicare Advantage plan. So here's the thing that everybody needs to think of. When you're first starting out, when you first turn 65 and you're going on a Medicare Advantage plan, you have 12 months or 6 months really of guaranteed issue, which means you can be on a Medicare Advantage plan for the first 6 months. You decide you don't like it, you can go to a supplement with guaranteed underwriting. Okay, or if you've been on a Medigap plan for 5, 10, 15, 20 years or whatever, and it's just getting too costly and you want to see what it's like to be on a Medicare Advantage plan, you can switch, try it out for 12 months, and then go back if you don't like it. All right, so that's just something that we'll talk a little bit more when we meet in person. All right, so these are just some things that for people with limited incomes that they can look at. Medicaid, which is joint federal and state programs for those with limited income and assets. Medicare savings programs, they help you pay your monthly premium, that $202.90 for your Part B premium. They help you pay for the deductibles and co-insurance. Extra help, which is also called LIS, which is limited income subsidy. It helps pay for Part B prescription drug plans. And then there's PACE, that if you're really low income, that they help seniors that are suffering from dementia and whatnot, they can't afford to go into assisted living, and they want to be able to stay at home. They'll help you as far as bringing help to you in your home. But that's all income based. All right. So the last slide is what is your next step? Okay, so if you're looking at this video, chances are I probably directed you to it. Okay, so at this point, now that you've watched this, hopefully we already have an appointment set up for us to go sit down and talk either over the phone or in person. If not, your next steps is to call me at any of that information below. That is my personal cell phone number. You'll get directly to me, 239-287-6580. Or you can visit my website at mjbenefitsadvisors.com. There's a box up in the corner that you can set an appointment right off my website. And there's more information if you got more questions. Or you can email me directly at mark@mjbenefitsadvisors.com. Okay, guys, that's kind of the end here. Again, I hope if you have any questions, if you don't, you can jump through this thing. If I went too fast, you can kind of jump through this thing and write down your questions. And when we talk in person, I'd be happy to answer them. Thank you very much. I hope you're having a wonderful and blessed day.